the symposium, we will present very different things about the Eculizumab. Eculizumab is a new approved treatment for NMO aquaporin positive. So that is approved by the FDA and by the EMA. And there should be patients with NMOSD but aquaporin positive. And we will present the results that Eculizumab reduce the relapses in patients with Eculizumab in 96%. And so that is really very, very important against placebo. But real was not direct placebo, but in this study, every patient could have another treatment. So that most of the patients, they were treated with azathioprine, mycophenolate, or prednisone. And also they were treated with Eculizumab or placebo. So that was not direct placebo. And most of the patients, they were treated with another treatment. So that despite of this, to have 96% of reductions of relapses in the Eculizumab arm, that is really a very, very good result. And that is really a treatment for really patients that they have a very high activity in the disease, in the NMOSD. The second important thing that we have seen subgroups, and there was no difference between the subgroups, between the age, between the disease duration, between the relapses, so that you can Eculizumab can be useful for all the kinds of the patients and disease duration and number of relapses. And the other important thing that we have a look at the patients that was in the monotherapy or the patients coming from rituximab, and in all of the patients, the result they were very similar to the patients that they were treated with other things. And regarding the side effects, one important thing is all these patients should be vaccinated with meningitis with the meningitis vaccination, because it's very important because of the risk to have a meningitis. But the patients, when these patients are vaccinated, they don't have meningitis. And when you look at the most frequent side effects, they are really very few and they are very mild. That is headaches and nasopharyngitis infections, nausea. But there's a treatment that the patients they can tolerate really very, very well. And regarding the infusion is every 2 weeks. And this is really very well tolerated. And the patients normally, after the first or the second infusion, they have no more adverse events related to the infusion. So that in summary, that is really is a treatment that is a target. The treatment is targeting the C5 complement. That is a very specific target. And that is the reason why it's so efficacious. So that's really that is a reduction of 97% of relapses. And that is very well tolerated, and they have very few side effects. And that is really very important to have the patients vaccinated with the meningococcal vaccination.